Chapter 33 Forensic Nursing. By its definition, forensic nursing is a specialized nursing care that focuses on patient populations affected by violence or trauma. The International Association of Forensic Nurses was formed in 1992 when 74 nurses, most of whom were sexual assault nurse examiners or SANE nurses, came together to create an organization representing nurses whose practice overlapped with key areas of forensic science and law. A year after its creation, the organization had more than tripled in size. By 2019, the IAFN's membership had grown to well over 5,000 nurses. The group now represents nurses who are forensic nurse generalists, SANE nurses, forensic psychiatric nurses, death investigators, risk managers, coroners, correctional nurse specialists, and others. Forensic nursing provides education, prevention, detection, and treatment of the effects of violence in individuals, families, communities, and populations. They also provide expert court testimony in cases related to their areas of practice and expertise, input on policy changes within forensic settings, and the evaluation and diagnosis of both victims and perpetrators. In our case study, after doing an internship in a psychiatric correctional facility, Hector becomes interested in becoming a forensic psychiatric nurse. While he is interested in providing direct psychiatric services to perpetrators of crimes in particular, he would also like to be able to someday offer input on policy changes in the correction setting and offer evaluation services for inmates. The IAFN recommends forensic content be included at all levels of nursing education. Specialty forensic nursing education could be included in both the associate or diploma registered nurse programs, as well as BSN, MSN, DNP, and PhD. A registered nurse who is employed in a forensic setting can be called a forensic nurse generalist if that nurse has completed further training through continuing education or graduate studies. The nurse may acquire additional knowledge and skills by completing a certificate program comprising continuing education in an area of forensic nursing. They can also gain expertise by taking secondary education electives or pursuing a minor in forensic topics. In the case of advanced practice forensic nurses, this is a master's level. While the credentials, there is no master's level credentialing, the qualifications are a master's education with credentials in another area, such as nurse practitioner with a specialty focus, and related coursework. This related coursework could take everything from psychiatric assessment and intervention skills, death investigation, forensic wound identification, evidence collection, family violence, sexual assault of all types and in varied populations, introductory law, and principles of criminal justice and forensic science. At the doctorate level, a DNP may evaluate and apply evidence-based forensic practice for the improvement of education, clinical practice, systems management, and nursing leadership, while a PhD would prepare nurses to initiate and conduct research in an area of forensics, to advance nursing science, and to ultimately advance forensics as well. Back to our case study, given Hector's ultimate goal of influencing policy changes in the correction system, as it relates to treatment and the nurse's role there, which credential will be most useful to Hector? Would that be A, an advanced practice forensic nurse, B, a DNP, C, a PhD, or D, a forensic nurse specialist? And since he is applying that to use, that would be B, a DNP, as this prepares nurses for systems management and nursing leadership. Neither forensic nurse specialist nor advanced practice forensic nurse programs will take his education far enough for this goal, while a PhD program would focus more on research skills. The roles of the forensic nurse are varied, everything from identification and assessment of victims, the creation of appropriate treatment plans, or the collection of documentation and preservation of potential evidence, and they would also follow the victim from trauma to trial. In the case of a SANE nurse or sexual assault nurse examiner, they are care of adult and pediatric victims of sexual assault, and that SANE nurse training course is typically 5 days or 40 contact hours. The coroner is a public official charged with the duty of determining how and why people die. A deputy coroner or death investigator's judgments are based on the history, symptomology, autopsy results, toxicology, other diagnostic studies, and the evidence revealed in the case. In most states, you have to be a doctor to be the county coroner, though I know in West Virginia you can be the county coroner with a forensic nurse practitioner. Traditionally, the coroner is a public official, primarily charged with the duty of determining how and why people die. Increasingly, nurses are prepared as the death investigators or deputy coroners. They work as death investigators in the medical examiner's or coroner's office, or even independently in private offices. A forensic psychiatric nurse would be a generalist or advanced practice level. They would be graduates of education required at advanced practice level and can complete further training through Con Ed or certificate programs. Forensic psychiatric nursing provides skills in medical nursing as well as psychiatric mental health nursing assessment, evaluation, and the treatment of victims along with perpetrators. The criminal justice system, they're going to need a good understanding as well as strong communication skills to communicate both with the perpetrators and the interprofessional team. A subspecialty of this would be a competency evaluator, and they collect evidence and evaluate a perpetrator's intent. They also work to determine whether the perpetrator had diminished capacity at the time of the crime. The roles and functions of the forensic psychiatric nurse include psychotherapist, forensic nurse examiner, competency evaluator, fact or expert witness, a consultant, or even a hostage negotiator or criminal profiler. A psychotherapist is a forensic advanced practice registered nurse in a psychiatric mental health field. It could be anything from individual, family, or group therapy. The psychiatric mental health nurse practitioner or psychiatric mental health nurse board certified have prescriptive privileges and initiate pharmacotherapy along with their psychotherapy. The forensic nurse examiner conducts court-ordered evaluations regarding legal sanity or competency in a court case. They could also respond to specific medico-legal questions as requested by the court. They may even be required to render an expert opinion in a written report or during courtroom testimony. Some definitions: legal sanity is the ability to distinguish right from wrong. It could also be assessing the use of drugs, the medical condition affecting their reasoning, and the social context of the crime. And their competence to proceed with trial as well. Defendant's mental condition at the time of trial is going to be key. Legal tests of sanity may include the use of McNaughton rules that includes the terms irresistible impulse and guilty but mentally ill. Irresistible impulse acknowledges that persons may have known the criminal act was wrong. However, it stipulates that if a person could not control behavior because of a psychiatric illness or mental defect, the defendant's not guilty. Those who plead guilty but mentally ill are remanded to the correction system, where they receive treatment for their mental disorder. They are then subject to the correction system's parole decisions. A competency evaluator determines legal competence of a defendant. Assess the mental health or illness, conduct a forensic interview, provide documentation, complete a formal report to the court, or testify as an expert witness. A fact witness is someone who has personally seen, heard, or performed, or documented, whereas an expert witness is recognized by the court as having a certain level of expertise in a designated area. A consultant provides cooperation between mental health and law enforcement. They provide advice to the mental health agencies regarding the care of the individuals with legal issues, while they also consult with law enforcement regarding the status and suggested treatment of individuals with mental illness. They advocate for families and patients and focus on a perpetrator's well-being, even if that results in civil detention and admission to the hospital. They may serve either side in a court case. A hostage negotiator, on the other hand, can be on call around the clock to assist law enforcement officers on the scene, provide suggestions regarding negotiation techniques, assess the mental status of the perpetrator, provide a link to mental health agencies, participate in a critique of the hostage incident, assess the released hostages, and provide training and communication skills to law enforcement officers. A criminal profiler attempts to provide law enforcement officials with specific information about the type of individual who may have committed a certain crime. Correctional nursing refers to the care of people who are involved in the criminal justice system. It can present challenges to the way nurses think about patients. Working in a correctional setting alone does not make a person a forensic nurse. Advanced education and clinical practice focusing on the unique needs of the population. Correctional nursing refers to people who are involved with the criminal justice system. Often this presents challenges. I've known a few nurses who went working in corrections and jails. And while some loved the field, others couldn't get out quick enough. Correctional nursing deals with custody versus caring debate. What is the role of the correctional nurse? It's defined by the location of the work or the legal status of the patient. Correctional nursing provides treatment and services for inmates with chronic psychiatric conditions. the care for the inmates in a cycle of homelessness, psychiatric hospitalization, and imprisonment, the importance of treatment for the incarcerated individual. Because of the long term effects of recidivism or repeat offenders and resource allocation, policymakers and legislators are beginning to recognize the importance of providing treatment to incarcerated individuals. Especially critical within this population is a history of trauma or PTSD. However, the correctional setting is not conducive to the intensive therapy required to treat these issues. Unfortunately, the needs of the vast majority of people in the correctional system with PTSD or a history of trauma are not adequately addressed. And wrapping up with an audience response question. A person charged with murder was found not guilty but mentally ill. This individual will A. spend the rest of their life in a psychiatric facility, B. spend the rest of his life in prison, C. will most likely face the death penalty, or D. may be eligible for parole. And the answer here is going to be D. They may be eligible for parole. Those who plead guilty but mentally ill are remanded to the correctional system, where they receive treatment for their mental disorder. They're then subject to the correctional system's parole decisions. But anyway, that's all we got for this chapter. I'll see you in the next slides.